Good day. This is the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. I am Dr. Linda Snetselaar, Editor-in-Chief of the journal. And today I have with me Dr. Lizbeth Moreno, who recently completed a postdoctoral fellowship at the Food is Medicine Institute at the Friedman School of Nutrition Science and Policy at Tufts University. And Dr. Ronit Ridberg is a research assistant professor at the Food is Medicine Institute at the Friedman School of Nutrition Science and Policy at Tufts University. Welcome to both of you for this editor's podcast on the topic of food is medicine.
Thank you so much. I think we're both really excited to share this research with you.
My first question relates to the fact that your article is focusing on nutrition and culinary education, and you're looking at food as medicine interventions. And so I wondered if you would begin by telling us why this area of study is important.
Yeah, absolutely. So this is Ronit Ridberg. To your question, we know, of course, that poor diet remains one of the leading drivers of poor health in the United States. And for those who are new to food as medicine, I'll just share that food as medicine programs aim to address that fact by integrating healthy food directly into healthcare delivery as part of a patient's treatment plan. So in this review, we focused on these healthcare-based food as medicine programs that actually prescribe food. So programs like medically tailored meals, medically tailored groceries, or produce prescriptions. But as your listeners and your readers are well aware, providing food is usually not enough, right? So lasting behavior change really requires building knowledge, skills, and confidence around healthy food purchasing and preparation. And the food as medicine field knows this too. So typically food as medicine programs will include nutrition or culinary education or both. And until now, the educational components of food as medicine haven't really been well understood nor consistently described. Like, what are they? Where do they take place? Who delivers them? With what frequency? And we knew that we would encounter inconsistency in our search, but I think we were all shocked that we had to exclude 170 food as medicine studies simply because they didn't report any information about an educational component. So we think that nutrition and culinary education are essential for effective food as medicine programs, but the fact that these elements are often the least defined part of food as medicine programs not only makes it hard to replicate practice, but it also really complicates the evaluation of food as medicine on health outcomes. So our goal in undertaking the review was to help bring clarity and structure to this element, especially as these programs continue to scale nationally. And we also really wanted to elevate the conversation about the importance of this educational component for food as medicine implementers and researchers.
Excellent. Thank you so much. My second question, what are some practical takeaway messages from your article?
Great. So this is Ronit. Again, I will share a couple of examples, and then I'll also pass to Lizbeth to share a few more. The first takeaway is that nutrition and culinary education is definitely happening in food as medicine, and that's great news. But like I mentioned, there's no standard to reporting nor to evaluation, and the variation between studies was quite broad. So for example, across the 100 studies in our review, we cataloged 10 different types of educational components, and we also logged whether multiple components were offered in individual programs. And our findings demonstrated how hard it is to compare across studies. So for example, you have one produce prescription program that included 5 educational components: printed materials, video tutorials, cooking classes, workshops, and telephone counseling. And on the other end of the spectrum, a medically tailored grocery program that simply included a recipe handout in each box of groceries. So a second takeaway is that most education is still delivered in person. More than half of the programs relied on in-person sessions, usually taking place in clinics or hospitals. And that can be really beneficial for connection and integration with care teams, but it can also create access barriers. Meanwhile, digital tools like apps or video modules were used surprisingly rarely. which suggests there's a lot of room to expand the ways that education is delivered. This finding also might be reflective of the publishing lag time and the speed of the field's evolution, as I personally know numerous programs currently using text messaging or chatbots. So we may not be seeing that reflected in the literature yet.
This is Lizbeth Moreno, and I'm really glad to be here and share with you part of our work too. And building on what Ronit mentioned, another thing that became very clear when we reviewed the literature is that reporting is still a major challenge. In almost 43% of studies, we couldn't even tell who delivered the education, and only 16 studies evaluated their educational component at all, usually just attendance or satisfaction. So this really highlights the need for more transparency and more rigorous evaluation. But at the same time, we also saw a lot of opportunities. Programs could incorporate more digital tools, more culinary instruction, more community-based learning, and more cultural tailoring. So overall, the field has a lot of room to grow and innovate.
Thank you. My next question relates to RDNs working in the field, and I'm wondering if you could tell us how an RDN might use your outcomes in work with clients.
Thank you. This is Liz again, and that's a really great question. One of our main messages for our review is that the role of dietitians really matters in food is amazing programs. RDNs were actually the most identified educators delivering nutrition education in these programs. However, their involvement was clearly documented in only about a quarter of the studies. So this suggests a huge opportunity for RDNs to help define and elevate their role in food is medicine program. Another important takeaway is the need for more structured and multimodal education. Many programs rely just one type of education, often something simple like printed materials. In this case, RDNs can advocate for richer combination. For example, counseling together with cooking class, or maybe printed materials combined with virtual follow-ups to create education that is more engaging and practical for clients. In addition, we found that the effectiveness of education is rarely evaluated. Because of this, RDNs can play an important role in bringing evaluation into the conversation, tracking things like changes in eating habits, skills, confidence, or engagement. Even simple measures can help to demonstrate the value of this program and support sustained funding. And finally, regarding this question, collaboration is key. Very few programs involve chefs, culinary instructors, and community health workers. Yet, these partners can make nutrition education more hands-on and culturally relevant. RDNs can help guide this collaboration and improve the education component of food is medicine programs. Ultimately, food alone is not enough. Education is what helps people to turn food into lasting health, and dietitians play a really central role in making this happen.
Thank you so much. I want to invite readers to your article in Jan that's titled Nutrition and Culinary Education in Food as Medicine Interventions, a Scoping Review. And please go to this article to read more about the topic of food as medicine. And to both of you who were interviewed today, thank you so much for your time. And thank you for this very nice overview of your article. I know that the ideas you have presented today will be of great value to anyone going to the article and reading it eventually. So again, many, many thanks.
It was a pleasure to talk to you. Thanks for having us.
Thank you so much as well. It was really fun.
Thank you for listening to our discussion today. Additional scholarly articles related to today's topic are available on our website at www.jandonline.org. If you found this discussion informative, please like and subscribe for more content. Thank you for your time and support.